Assalamu alaikum and welcome to our AMANI Birth in the Gambia series. We're so happy to be here with you talking about how we improve maternal outcomes, maternal and newborn outcomes in the Kingdom. I'm Aisha El Hajar, founder of AMANI Birth, and I'm here with Salama Karama. She has a deep interest in improving birth outcomes in Gambia and feels that education, knowledge is power, and that Gambian women deserve the same kind of education and knowledge that we have all around the world. So welcome, Sister Salama. How are you?
And welcome to that. Assalamu alaikum. Thank you, Aisha. So today we're talking about the significance and role of water during pregnancy. Um, can you explain to us briefly what is the significance?
Yeah, absolutely. Well, first of all, if we're talking about in the pregnancy itself, you could actually end up with a preterm birth if you're dehydrated a lot. So you want to make sure that you stay well hydrated. Lack of hydration can lead to uncomfortable and dangerous urinary tract infections, also leading to preterm birth. Not to mention, it's reduces your energy, by about 30%. And the last thing you need when you're pregnant is something that's going to reduce your energy. It can cause heart rate increases, blood pressure changes. It can actually mimic a fever, and then we think maybe you're sick. So then maybe we quarantine you because we think you're sick because you have a fever, or your baby's and have a fever during the birth because you're dehydrated, and that turns into a baby in a special care nursery because we don't know if it's hydration or is it a matter of mother having infection. So it's really really important that we keep that hydration up. And from my understanding in the Gambia, I've not been there, but I would imagine it's a very hot, humid climate. Is that correct?
Yes, yes, yes,
With hot and humid climates and a lot of physical activity, and combined with that comes a lot of perspiration. When
yes.
we have perspiration, you're not only losing water from your body, but you're also losing sodium, which is also an important aspect here. Sodium is an electrolyte balancer. It's important for your blood volume. If you are low on water, low on sodium, as well as protein that we talked about last week, those things
Yes.
can lead to hypovolemia, which means a low blood volume, making you more susceptible to death after birth from the postpartum bleeding. So
Wow.
so a huge step here. When we talk about hydration and even protein, mix those all together. Then you're talking about a matter of life and death when we talk about afterbirth bleeding and being able to tolerate the after bleeding. So
It's the-
I think that it's important also that Salama, the quality of water. I don't know Gambia's water source, if it's if you have clean water source or not. But even in more countries, we have to be careful, like with tap water, for example, because tap water
yeah.
can be full of chlorine, lime, lead. We don't want fluoride during our pregnancy. It's a neurotoxin. It's not it's not an element for brushing your teeth, let alone for your placenta. So
Mm,
if you don't have these elements in your water, a good water filter might be the best answer. Good quality bottled water might be a good answer. Water is not necessarily a good answer, depending on what's in your water, because the
mm,
water can actually concentrate the harmful elements even more, because the water evaporates, but then the elements don't evaporate, depending on what it is. You could actually
right.
increase the concentration of things like chlorine and lead when you are boiling the water. So boiling is not always the right answer. So you have to,
That was an option. Okay.
having a clean water source, as much as possible, is super important as well. You know,
Okay.
um, in terms of the amount of water, it has to do a lot with body size. We say for a typical woman, 2 liters of water daily or 2 liters of liquid. It doesn't always have to be water. Soup
Mm-hmm.
counts. If you're drinking
Exactly.
milk, that counts. All of your liquid intake counts. Juices, all of this stuff counts. Make sure it's not sugary stuff
Fruits.
though, because
Because
sugary
in
stuff.
Gambia, yeah, they eat a lot of fruit there, oranges,
Yes,
watermelon, papaya. So
yes.
fruit also has
So all that stuff
content.
will count towards your hydration.
Okay.
But we typically say 2 liters per normal sized woman. If you're someone larger or smaller, then our guide is 1 liter per 22 kilograms of maternal weight.
Okay.
So that's kind of a guide. But two liters is pretty average for most of us. Two
Okay.
liters is a pretty good,
But they should
easy
keep in
number.
mind that if they're sweating, if
Then,
they're,
then right,
losing
need
water
more.
to perspiration,
Right.
increasing that water intake. Yes. Okay.
Exactly. And the more active you are, of course, the more you're going to need. So,
Good morning.
your
Okay.
physical activity, your body size, how much you're losing through perspiration all matters. And again, keeping an eye on sodium as well.
Okay. Okay.
Yeah.
SubhanAllah. And just some of the recommendations and sources that, that they can increase their water. Like you said, it doesn't necessarily have to be just water, but it can be
Right.
like, milk, juices, fruits, soups. Um,
Absolutely.
adding, they can flavor their water. Some women during the early parts of their pregnancy, it's hard for them to
Yes.
drink much water, but adding lemon, oranges, or
Yes.
cucumbers
Ginger.
and mint,
Adding ginger,
ginger.
like ginger tea is
Yeah,
great for if you're having nausea. Yeah,
yeah.
exactly.
They make a very nice ginger drink there that
Oh my,
that could be warmed and you can drink it or drink it cold.
awesome.
And a lot of soups like they have soups like called pepper soup. It's a little spicy, but some women actually prefer a little bit of spice in the early
Nice.
parts to help with the nausea.
Awesome.
Yeah,
Good.
yeah, inshallah. Alhamdulillah. And I think we hit all of the topics. Again, like you going back to the significance of water is that it helps increase the blood volume, like that
Absolutely.
built-in safety net of the 50% increase in blood volume. And the best way to maximize that is making sure we have adequate fluid,
Yep.
and coupled with the protein and like we spoke about last week, 80 to 100 grams of protein,
Absolutely.
along with adequate salt intake.
I
We want
always say
like,
salt your food to taste, and also consider, you in the Gambia, I'm assuming you're eating fish from the salty sea. So
yes,
this is going to increase your sodium because if you're eating those foods. If you have pickled foods, if you have, I don't know if seaweed is in their diet or not, but these things are also part of the sodium intake. So those are all things that are part of that sodium intake, besides just putting salt on, table salt on your food. So those things count
okay.
as well towards sodium. But we typically say salt your food to taste. So 2 liters of water, salt your food to taste, 80 to 100 grams of protein in your diet. That is, your absolute best prevention against things like UTI, against postpartum death, severe need death from a postpartum hemorrhage, as well as not having a preterm baby, because the UTIs can lead to a preterm baby, which can be caused from the lack of hydration as well. So very important topics today. I appreciate you bringing to the forefront, and I do hope that more and more women are tuning in and getting this information and applying it in their lives, inshallah. So thank you so much for the time that you're spending.
Thank you, Aisha. Alhamdulillah. And if anyone has questions, they can add it to the chat box or reach out to us through Messenger. We are here, to help you with any questions that you may have regarding your pregnancy and birth and labor and just how you can prepare. Alhamdulillah. Okay, Aisha. Jazakallahu khairan.
Absolutely. And if there's anything in the chat box, we'll catch them after the broadcast. Thanks so much, Selma. Take care.
All right.
Assalamu
Assalamu
alaikum.
alaikum. Wa alaikum salam.